Nationally, industry leaders have been working to educate providers on the patient-driven groupings model. A core element within that education is the emphasis on preparation. The most pressing areas that providers need to focus on in preparation for implementation in January 2020 include developing and refining episode management processes related to timeliness of care, discipline utilization, visit utilization, interdisciplinary collaboration, and clinical leadership development. Timeliness of care is a significant factor in determining the PDGM admission source category from the Medicare claims data. Any delays in care will have the potential to cause what would be an institutional admission source revert to a community admission source, which is paid at a much lower rate and may not cover the costs of providing care for the patient. Discipline utilization is an important area for providers to focus on because of the many changes to the payment methodology, most notably the change from one 60-day episode to two 30-day periods within a 60-day episode. Therapy services remain critical to successful home health outcomes. Providers will need to focus more on having the right person in there for the job, using disciplines wisely within their scope of practice, preventing duplication of services. Visit utilization is a key area for providers to focus on for several reasons, including the fact that CMS has removed therapy thresholds as a payment factor. And LUPA threshold will range from 2 to 6 visits depending on which of the 432 different case mix categories the patient falls into. Based on the current national data, the clinical groupings with the highest likelihood for LUPA under PDGM are MS rehab, MMTA cardiac, and the MMTA other category. Interdisciplinary collaboration is essential not only to ensure accuracy with OASIS functional items and diagnosis coding, but also to ensure proper reimbursement and accurate clinical outcomes. The HERG scoring methodology is much more complex. And for instance, the functional scoring is not only dependent on answers to OASIS items, but also dependent upon which of the 12 clinical groupings the patient falls into. An agency's chances of success under PDGM are minimal without strong clinical leaders to facilitate best practice episode management programs. Strong clinical leaders are necessary to ensure staff education efforts are ongoing. They're preventing avoidable LUPAs, preventing rehospitalizations, and facilitating the necessary best practice measures to ensure those things. Providers should have already started preparations for PDGM. Those who haven't should develop a call to action and immediately begin their preparations to ensure both office and clinical staff are prepared for the momentous changes ahead. Agencies that are proactive and develop best practice episode management programs, including appropriate visit utilization patterns, will position themselves for success both clinically and financially under PDGM.